Welcome, everybody. My name is Candace Sinai with Cigna, and you are now in the best discussion of the day, late in the day, so I appreciate you being here. Just a little plug, the Evernorth screening facility is still open until 5:30. It's in the front of the Hilton. They're doing biometric screening, so blood pressure, cholesterol, etc., and everybody should go down there. There's a lot of good giveaways as well, and it's the woman there's really great, and somehow I was an inch taller, so your BMI might be lower if you go today. Let me introduce to you Mark Manning. So Mark is a Chief Growth Officer with Simplify Healthcare, and he looked like he'd been in the industry quite a long time. I think it said 30 years, and so I was pretty
impressed. We're going to have to use the microphone to respond to that.
Yeah, but across all industries.
I guess thank you.
Yes, I think so.
It's been a long COVID period, maybe.
COVID's been a long time. Agreed. So you've been kind of everywhere in the healthcare spectrum, but just to get to know Mark a little bit better, I wanted to put you in the hot seat for a second. So, ready for this? Favorite TV show?
Well, right now it's probably Yellowstone.
Oh, good choice. Cookies or cake?
My wife tells me I can't eat sugar.
Coffee or tea?
Neither.
Band? Favorite band?
Well, that's a good question. So, it was U2, now it's Green Day. Tomorrow it could be Weezer? What's his name? I got kids.
I love Weezer.
Oh, okay. I don't even know what his name is.
Okay, beer or wine?
Yes.
Both? Yeah. Okay, in person versus virtual?
In person's better.
Very good, very good. Okay, can I have a round of applause for Mark Manning?
Thank you very much. Candace, thank you. And I'm here with Bomik, and I'll ask Bomik to introduce himself as well in a moment. But I am Mark Manning. I'm the Chief Growth Officer at Simplify Healthcare. Simplify Healthcare, it's a good time to be a Chief Growth Officer at Simplify Healthcare. We're an Inc. 500 fastest growing company. We started the company in 2015. We have been in the Inc. list 3 years. We've been on the Deloitte & Touche list Fast 500 3 times. What we do is product plan and benefit configuration. We have 38 customers, all health plans in the United States. And what we're going to talk about today is something that we do, in my mind, particularly well. Our customers manage about 1/3 of all PBPs that are submitted to CMS in the US. In fact, Cigna is one of our customers. What we do for those folks is we automate the full PBP process. We create a source of truth of all the product plan and benefit information, all your PBP information. With a push of a button, when that's organized, you go in there, you create your new plans you would load it with your 2022 data, create your new plans for 2023 now. With a push of a button, you can submit your plans into CMS. Through the survey tool, you no longer have to re-enter your information to be able to get your information into CMS. We did something when we started this company is we kind of looked at not just Medicare, but health plans in general. And one of the big flaws we had, my background is prior to being here, I ran Pegasystems healthcare business. And then prior to that, I ran HMO Blue in Massachusetts. And one of the big flaws or issues that we ran into with pretty much every health plan was when we talked to them about how you wanted to manage your product management effort, almost all of them told us that we want to offer fewer plans because they're easier to manage and our back-end systems will be able to work. What we wanted to do and what we've done, and we're going to show you this today from the perspective of our customers that are submitting the 33% of the PBPs into CMS, is we put together a process and tools that allow our customers to be able to configure the benefits and the plans that they want to for their customer base that work. Kind of a little different change, and it's where everybody's going, right? If you were at the session before this with the Lyft person, sorry, I don't remember their names, but they were talking about how they're working very, very hard to make transportation a benefit, and there's all the different variations of that. What we've done is set up a tool such that when those new benefits arrive, they're going to be easily incorporated into your plan information, and we'll process the rest of it. By virtue of producing that database of your plan information, with a push of a button, we also can produce your ANOCs and EOCs. We manage all of the black language as well as all the updates and changes that come from CMS. So we make it very, very easy to produce your ANOCs and EOCs. We have workflow tools that route information. So our customers are doing all of that. The other thing that our customers are doing very, very well with the PBP information is integrating that data directly into the claim stream. So no longer is it the case, and we'll talk more about this, and then you asked me to introduce myself, right? Sorry. But no longer is it the case for our customers that they have to both create an Excel spreadsheet of benefit information and plan information, and then retype that into Facets or QNext or Health Edge or whatever it is. We automatically link that into it without actually putting any lift on Facets or Health. There is some integration work, but we do that. We also take that data and integrate it into the call center so that your benefit inquiries, which is more than half of the inquiries coming in both from member and provider services, can be answered very, very quickly. And we'll talk a little bit more about that. But prior to that, I had asked BOMIC to join us. BOMIC has a fair amount of research on the market and why this matters, and I thought we'd start there and then dig in.
Thank you, Mark. Good afternoon, everyone. Thanks for joining in this late afternoon session. But as Mark said, at Simplify Healthcare, we are very passionate about this particular space of Medicare Advantage, along with other lines of businesses as well. And we have been looking at some of the trends in the industry, especially in the Medicare Advantage space. And that's what this first part of this conversation is going to be about. As you heard from Mark's voice, there's a lot of excitement about the solutions and the problem space we solve. So in the next couple of minutes, I'll just walk you through some numbers. Those who want to take a test after this, please note down some of these numbers because they change very rapidly. But let's spend some time educating ourselves as to what are the trends looking like, what are the numbers telling us. And many of you who are either practitioners or are deep into this space already know that the opportunity that lies ahead of us is enormous. And we'll continue to talk more about how at Simplify Healthcare we see this space and what can we collaborate on. Some of these are pre-COVID numbers, but if you look at the Medicare Advantage landscape, take any decade block, 2019 to 2009, 2018 to 2008, and this trend just keeps going upwards. In fact, when I was looking at it a couple of days ago, the latest publications just came out, and when we're looking at 2021 numbers, 2019 was 22 million members in Medicare Advantage. End of 2021, or in 2021, the enrollment went up. It's 26.4 million members. Of the 63 million members who are eligible, roughly 42% are now a part of Medicare Advantage. Just 2 years ago, it was 34% share. So right there, there's an 8% increase year over year. If that was not enough, just looking at the projected spend by 2029, 2030, this is supposed to cross $1.3 trillion. It's not just the dollar value, but if you look at it as a percentage of the GDP, that slice keeps increasing as well. So all in all, what we are saying is there's a lot at stake. There's a lot from a payer standpoint. The market keeps getting bigger and bigger. And when you combine the spending with the number of people who are interested in enrolling in the MA space, by 2030, they say that 50% plus, I think the number was 51% of the total eligible enrollees will opt for Medicare Advantage. So that opportunity that it offers in this space is bigger and better than ever before. This one is pretty interesting. Hard to believe that this was just 2 years ago because all of the things that you see on the left side, all of the states that are in the blue color, maybe hard to read from the back, are now 40% plus, which means that starting from all the way from California to Texas, that entire band has 40% or more of the eligible enrollees choosing Medicare Advantage. So the trend is changing. Minnesota, Florida, and Puerto Rico have more than 50% of their eligible Medicare population opting Medicare Advantage. So the trend is sliding more towards a 40-50% mark, and in a few years, I won't be surprised if half of the states are 50% and above. Everyone here knows star ratings, right? How important they are and the kind of value they bring to any payer space. In 2019, as we can see, 72% of the MA enrollees chose 4 or more star rating plans. What's interesting is in 2021 also this was 72%, but the slice of 4.5 stars went up from 21% to 33%. The slice of the 5% went from 8 to 9% to close to 10%. So the number seems small, but when you think year over year comparison, the 4.5 stars share went up by 33% over the 2-year period. What that tells us is a lot of consumers are becoming more and more picky, if you will, if that's the right word, about the type of plans they want to give their business to. And again, to the payers, that means there's a lot more onus on making sure that there is continued investment in making sure that your plan continues to excel and get better year over year. Some of the low star rating plans are in real trouble because they may not be getting the slice of that increase. And, that could be a wake-up call for them to do things better if they want to compete in this ever-growing market. This shows how the enrollment is distributed amongst the individual, the employer groups, as well as the special need plan. One interesting thing that I noted compared to 2019, the SNP enrollment is starting to pick up. More and more awareness. It went from 13% here to more than 15% on the SNP side, and the slices for the other things stayed the same. But as a payer, if you are in the SNP business, this is again an exciting time because this slice is increasing. The C-SNP, D-SNP, and I-SNP, everything is starting to get bigger and bigger, and there is more awareness and more variety that is coming out of the marketplace. But at the same time, the consumers are also starting to choose the right plan that meets their medical and other needs. The last slide on this topic is it's not just the Medicare Advantage, but also some of these additional benefits. I was talking to our friends at Versant Health. I don't know if anyone is here, booth 404. We are just talking about the prescription drug benefits. And it was interesting that Medicare Advantage just by itself only covers the prescription eyeglasses when followed by cataract surgery. But other than that, they need to have this additional benefit to qualify for eyeglasses, just like most of the commercial plans do. I never knew about it, that it is such a high percentage and this is the kind of spread, but it's interesting. And they said that almost everyone, I should say, in Medicare needs some of those prescriptions and eyeglasses. But the point is, as we understand this space and more SDOH related services or more and more supplemental benefits are becoming part of the plan, the ability for a healthcare payer to maintain and manage that plan becomes ever more challenging. And the traditional solutions, they may run out of the bandwidth over there. And very soon they may start falling into challenges both on the operational as well as execution front. So the moral of the story is that wherever you see there is growth, there is opportunity. Healthcare payers are on a gold mine, and there couldn't have been a better time in terms of getting into this space, expanding your footprint, or getting better at what you do in the Medicare Advantage benefit plan offering. It says health plan challenges, but I would say these are health plan opportunities. Enrollment is growing like crazy. Spending is growing. We saw how it could go up to 1.3 trillion, maybe even more, with inflation and everything that's going around, who knows. The plan growth, the number of available options in any market segment, I would say most market segments, everyone has access to 10 plus plans to choose from. So your plan, if it's not the best, chances are that the customer will choose something else. When you combine all of that, there's also competition growth. There are so many players coming into this space. There are a lot of technology companies, non-traditional companies who probably never did healthcare, but they're starting to see the value and how they can bring various service providers together to form a plan and get business. So with all of that, health plans have both opportunity, and if they do not act, they do not do the right things, those could very quickly become challenges. With that, Mark, I'll turn it over to you to see how we can go forward from here.
Yeah, thank you. I'm going to stand. My wife is a bit of a joker, and I think she probably shrank my suit since I wore it before COVID. So where do we go from here, right? So BOMIC, did a very good job at describing the opportunity, right? The enrollment into Medicare Advantage is increasing like crazy. The need to be competitive because everybody's going there is growing. So how do you get to the point where you can configure the benefits that you want to, or more importantly, what your membership or those groups, those EGWIC groups want? And how do you do it in a way that's cost effective? So what I was talking about earlier is sort of how 1/3 of all the PBPs in the country are being processed today. And it's a pretty straightforward process, right? Prior to using that process, most of our customers, if not all of them actually, were capturing data in Excel, capturing data in benefit grids. And to get the information into CMS, they were taking those benefit grids and manually typing in the data into the surveys to get the PBPs to submit to CMS. The way they were getting data into facets was taking those Excel grids, copying the data, same way, typing the data into facets or into QNext or whatever it might be. And the data wasn't well organized for the folks on the services side either. Not to mention the production of the documents is a bit of a bear no matter what. So most of our customers that we work with came to us and said, hey, can you help us improve that? And we did, right? By production of that data source of truth, that one place to find your benefit information, where it's all located and integrating into all those processes, all of a sudden, you have an asset for your business as opposed to a problem. One of the key things around all of this is when we build a source of truth, basically our customers will go into that source of truth and configure their next year plans. And in our system, you can change a benefit, you can create a whole new plan, you can change a copay, all of that within the system, and all of that data carries down. But the other piece that's really critical is when we were working with some of the Blue Cross customers that we have, and all of our customers actually, we'd ask them going in, and BOMIC did a lot of work on this, we'd ask them going in, how long does it take to where you're configuring to configure your plan and then get it approved for sale? And some of our customers are saying, boy, that process can take upwards of 30 days. Now what we've done by virtue of automating all that process, you can configure a plan in about 10 minutes. With the workflow tool, you can route your plan information to a number of constituents at the same time, gather their feedback, so it's not a serial process where it has to go to one person to the next. It's a process where you can route it out to your legal team, to your medical management team, to whoever at the same time and gather that feedback. And then basically go to market faster with that product. And what we had seen with some of the studies we've done is we've taken that 30-day process down to 2 days, in some instances 3 days, but of that scale. And it's been a big help. The same process is used when reviewing documents. So we've been fortunate, right? We've got some very, very big customers, and we've got some very, very small customers, and a bunch of customers in the middle. One of our largest customers, when we met with them, I asked, hey, what's your process for getting your documents reviewed and approved? And they came to me and they found a big yellow manila folder. And it was about yay thick. And on the top of that manila folder was a sheet of paper. And the sheet of paper said, Joe, VP of Compliance. Tom, VP of Medical Management. Sue, blah, blah, blah. Joan, Legal. And their process was they take that document, that package of documents, give it to the top person on that sheet, have them review it. If they were good with it, they'd check it off, they'd move it to the next one. And I believe that, and that was a 30-day process, but I believe that after that first person checked it off, I'm not sure why the second person would even open it or look at it. And by the time you got to the fifth person, why bother? So really this workflow capability routes that information to the different constituents, has the capability to take a document like an ANOC, split it up. So if you only wanted your medical management team to look at Chapter 4 and review that, you could have them reviewing that while legal is reviewing the whole thing. They could check off that they approve it as is, or they can send it back with edits to be made. And that process has greatly improved their ability to get these documents completed and out the door accurately. The other thing that's was a big hassle for all of our customers was to manage the annual changes that CMS puts out. By virtue of having a system that a third of the PBPs are going through, we, as the owners of the system, do those updates at the beginning of the process. So we'll go in the beginning of the year. It takes about 2 weeks to update all of CMS's changes for the coming year. And then during the process, we're getting the updates the same way all the plans are and making those changes for all the plans in the system, and it applies to all at the same time. So we're getting it right, or at least consistent for everybody. And that's been a big help and a big time saver for folks. So where does all this get us to? The automation gets us to where the plans that are using a system that automates all of this can easily go out and compete. I threw this picture in because does anybody have a senior in high school besides me? Yeah. So Brian, my son, and I have been traveling around the country, driving and flying and seeing schools. And we both went into that process. This is a bit of a tangent, by the way, if you didn't already figure that out. But we've been in that process, and we went into it with eyes, kaleidoscope eyes, like Bill Walton would say. We're all excited about doing the process. Now we've hit the point where, he's writing the essays, filling out the applications, and boy, that whole idea that this was going to be exciting was just wishful thinking. I only mention that because somebody on my team put a lot of time and money into building this, and I thought I had to be using it. So where are we, right? Where can we get to where we have that? What's the approach? Keep going. I'll keep going. I know I'm between you guys and the end of the day, but just a quick summary of how all this would work and how right now a third of the PBPs are being managed. Basically, when the system gets set up, the PBP database that sits on the back end of CMS gets pulled in, and that's where your initial source of truth comes from, right? And every plan has that. If you submitted plans into CMS, you have that's an access database. That gets pulled in, you set up your source of truth. From that source of truth, you as a user would go in, build your plans for the following year, build your plans for your 2023 year within the system. As you're building them, a system, a process is smart enough, this one is smart enough to do data verification, so it won't accept data that doesn't work, right? Or it will question data that it looks at as questionable. Once that's built, that workflow tool will route that information, like I mentioned earlier, to all those constituents to try to get that plan approved for sale. Some places are faster and slower even with an automated system, but in any event, much faster than what they were doing with spreadsheets. Once done, with a push of a button, you can create the ANOCs and EOCs, that are templates to produce those documents, and summary of benefits, and handbooks, and other things. And nonetheless, that's there. Saving a ton of time, not only around the production of the documents, which are produced in 508 compliant, multiple fonts and multiple languages, but around the quality of it, right? I mean, it's kind of silly to think that in 2020, we're still producing documents manually. Right? Just kind of silly that that's it, but the customers we have prior to doing this were, and a lot of folks, still are. And that's just, obvious to me that it's introducing a lot of potential for human error. Oh, I switched the slide on myself. Once done, push of a button, submit the plans to CMS. Hopefully the plans get approved. If they don't, they spin back in, you update them, submit them again, they get approved. System comes back. The end state for the whole game, where the real value comes in, other than that you've gotten through the process You didn't have to work the crazy weekends and nights like you usually do. You know, it's more of a process that works. You integrate that data into the claim stream. If you were to do a Pareto analysis, and you guys all probably have, on what's pending through your claim system and your health plan, you'll see that one of the top pens will be something along the lines of a benefit mismatch. This solves that. The other thing you'll do is integrate that data into your call center. And we've integrated with Pega. We've integrated with MS Dynamics. We've integrated with Siebel and so on. But the integration is very straightforward. It's a mashup. So your customer service reps, they get a call, it comes in, you know, automatically the IVR or whatever the system is indicates that this is a beneficiary that has X, Y, and Z plan. Right, so it's really not about the person, it's about the plan they're in, because it's the benefit. All of a sudden, through your customer service rep, they're in the system, up pops an AI smart lookup tool. Your beneficiary is calling about X, Y, and Z service. You type in that, and it'll show all the benefits that relate to that and the coverage. On the group side, it's probably worth mentioning because we do a lot of egg work as well. We're also capturing the group information in the system. Some of the results, right? So speed to all the things we talked about in data quality. And also sort of a bit of a side benefit, right? So for stars, as many of you guys know, right, there's some money in this, in the stars game. There are two key drivers that relate to us that impact your stars score. One is member satisfaction, basically member complaints, and I'll explain why in a minute, but also de-enrollment, I got the word wrong, disenrollment. Two key factors that drive this. In some plans, your score could change from a 4.5 to a 4 based off one complaint, because the math kind of works that way if you're not large enough or you're smaller, on the smaller end. Same with disenrollment. This is kind of an interesting chart. It's kind of interesting that it came from here. Again, thank whoever paid for this one. It wasn't me this time. But the factor that, the two largest circles here, the factor that's driving member experience and leading to disenrollment or member complaints, the largest factor is being unable to figure out or get access to what your coverage is. By far. I mean, these two green dots, I don't know if you can read them, but that's what they're labeled as. And that's, you know, something that gets handled if you have an automated process that's feeding your customer service reps and feeding your documents that go out to your members. Another interesting chart, which is a little tough to interpret because, at least for me, right? I look at this and the volume of interaction with your members that's largest, like the largest channel of interaction to your members, and maybe I'm not saying it quite right, are your member materials, right? Now with that said, I'm not sure it's the biggest impact area, but when I look at it and I think, you know, back to how my mother handled her stuff, I mean, she spent a lot of time in the documents, and maybe it's just a factor of that age group, and I'm, you know, thank you for pointing out that I'm close to that age group. But, but that age group tends to use the member materials a lot, right? And this is where you're going to get not only whacked by CMS, but if a member's in there and they can't understand it, or they can't get to the information, you know, you're in trouble. Same. So in the end, through automation, I guess the point for today, you know, we showed you some data. We wanted to talk about how some plans have automated this process. I hope you kind of, you know, got the idea of how we've done it. And to automate something like this is a little personal plug. If you automate something like this through Simplify Healthcare, it's an effort that takes about 3 months. The bulk of the effort is in managing the blue language and documents, but nonetheless, that's the type of time that goes into a process like this. That's about all I had for today, and I know, you know, you guys are at the end of the day. Any questions for us? Comments? So, please.
How much does it cost?
Zero. It saves more than it costs. Good question, though. Am I the first person you've asked that question to? I'd be insulted if I am. Any thoughts or questions, anyone? Please keep us in mind if you're interested in hearing more about it. Simplify Healthcare. My name and all that contact information is there. Thank you all. It was nice meeting you all.